Is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and thank you for joining today's webinar on food access amid COVID-19. We're really grateful you've taken the time to join, especially because we know so many of you are working tirelessly to help children and families cope with this crisis. Thank you for the work that you're already doing. We hope that this webinar will provide some new resources to assist in that work and perhaps some information you can pass along to other schools and community organizations in your area. Because we do have a large audience today, we're going to keep the phone lines muted to avoid any background noise. We will take questions at the end of the webinar, so feel free to type in any questions you have in the chat box or the question box throughout the webinar. This webinar will be recorded, and all registrants will receive the recording and slide deck, so you'll have easy access to any resources linked in the slides. My name is Krista Hestorfer. I serve as a Child Nutrition Program Specialist at Hunger Solutions New York, where I focus on expanding the reach of out-of-school time nutrition programs, including summer meals and the Child and Adult Care Food Program. I'm joined by my colleague, Jessica Pino-Goodspeed, who is also a Child Nutrition Program Specialist, but with focus on the school meals programs. Her work includes expanding access to school breakfast and universal free school meals. We'll start off today with a brief overview of some of the latest figures on food insecurity, and then we'll talk about a range of federal nutrition programs that schools and communities can leverage to meet that increased need. We'll spend some time discussing pandemic EBT, including an overview of how the program works and outreach resources you can use to help spread the word. And then we'll revisit some more familiar child nutrition programs and discuss opportunities to maximize access and participation. And we'll leave plenty of time for questions, so again, please feel free to add them in the chat box throughout the webinar. But before I go further, I should introduce our organization for those of you who may not be familiar with us. Hunger Solutions New York is a statewide nonprofit anti-hunger organization. We focus on the USDA's federal nutrition assistance programs, including SNAP, WIC, school meals, summer meals, the Child and Adult Care Food Program, and now Pandemic EBT. We raise awareness of these programs and work to maximize participation among all who are eligible. We also conduct administrative and legislative advocacy to protect and strengthen the programs. We do this work because many people are struggling with food insecurity in our state and nation. The figures on this slide are pre-COVID-19. They provide a snapshot of 3 different metrics for measuring hunger. On the left is the USDA's household food security metric. The figures included here are at the national level. In the middle, you'll see the Food Research and Action Center's findings on food hardship, with those numbers representing New York specifically. And on the right is data from Feeding America's Map the Meal Gap Food Insecurity Report, again for New York State. For all 3 measures, the blue bar represents the rate of food insecurity or food hardship among all households, and the orange bar shows households with children. So you can see that no matter which measure we look at, there's a fairly consistent story, that even before the pandemic, more than 1 in 10 households were coping with food insecurity, including approximately 1 in 6 households with children. And unfortunately, but unsurprisingly, food insecurity is rising amid COVID-19. On the last slide, the figure from Feeding America showed a food insecurity rate of 11.1% for all households. That number is projected to increase to 16%, which represents an increase of almost 1 million New Yorkers newly food insecure. And we expect that households with children will continue to be especially hard hit. This graph shows national figures based on the Census Pulse survey. The blue bar shows the predicted food insecurity rate for February 2020 before the pandemic would have come into play. And the purple bar shows actual reported food insecurity post-COVID-19. You can see that there's an extremely disconcerting increase across all households shown on the left side, and that the food insecurity rate for households with children, which is shown on the right side, reaches nearly 30%. It's also important to note that food insecurity is a racial equity issue, and that the overall food insecurity rate doesn't tell the whole story. Looking at that same household pulse survey data, this time for New York specifically, and parsing out by race or ethnicity, we can see that households of color have significantly higher rates of food insecurity compared to white households. This was the case before the pandemic and continues to be true, especially as the health and economic impacts of COVID-19 have disproportionately affected households of color. So what are the consequences of experiencing food insecurity? As many of you know, experiencing food insecurity is associated with a range of negative outcomes, and for children in particular, experiencing food insecurity is associated with developmental risk and greater risk for mental health problems like anxiety and depression. It makes it harder for students to focus and engage in class, and is associated with increased tardiness and absences from school and behavioral challenges. The good news, and I do have some good news, is that federal nutrition programs are proven effective in reducing food insecurity among children and improving those health and academic outcomes. The challenge we have is that all of those programs are underutilized in our state and across the country, and that's why we're here today. While the existence of any level of food insecurity has always been unacceptable, the increased need amid COVID-19 really underscores the importance of maximizing these programs and making full use of additional flexibilities and new resources granted during the pandemic. So on that note, I'll turn it over to my colleague Jessica Pino-Goodspeed, who will speak about Pandemic EBT, one of those new resources available to ensure kids have access to food during the public health crisis. Jessica?
Thanks, Krista. I'm so pleased to have the opportunity to talk to you today about Pandemic EBT. So what is Pandemic EBT? It is a new crisis response nutrition program. It was authorized by the Families First Coronavirus Response Act. So this makes it a federal program that is administered by the USDA Food and Nutrition Services. Our state applied to administer Pandemic EBT throughout the state, and the office that took the lead on that was the New York State Office of Temporary Disability Assistance. So this is an important piece that the OTDA, the Office of Temporary Disability Assistance, is the one administering this program throughout New York State. It is not the local Department of Social Services or HRA, as we see with other programs. Pandemic EBT will provide a benefit for each child who would have received free and reduced price school meals if it was not for school closures in the 1920 school year. Pandemic EBT benefits will reach over approximately 2.1 million students across New York State who qualify for free and reduced price meals. The benefit for Pandemic EBT provides $420 in food benefits per child. It is equivalent to $5.70 per day schools were closed officially across the state due to COVID-19. Who is eligible for Pandemic EBT benefits? All children who receive free and reduced price school meals through the National School Lunch Program are eligible to receive Pandemic EBT benefits. This includes children attending private, public, parochial, or charter schools. Again, the type of school does not matter, whether in terms of eligibility for P-EBT. The qualifier is the National School Lunch Program. So children who are 3 and 4 years old attending universal pre-K programs who eat lunch through the National School Lunch Program also qualify. The same for adults who are 19 to 21, often those with disabilities who are still in school and receiving lunch through that federal program also qualify. Again, children in foster care, undocumented students, all that are receiving those free and reduced price school meals. We really wanted to clarify as well, as over 1.7 million children across New York State attend a school where lunch is free for all. So P-EBT benefits also applies to all students enrolled in those schools where lunch is offered free for all. This is specifically in the case where schools are operating the community eligibility provision. So folks can often refer to this as a community eligibility school, a CEP school, but also qualifies for schools who operate provision 2 and offer breakfast and lunch for free for all. Many times there's confusion among parents about where those free lunches come from, but helping families understand and get in touch of how those meals are offered for free can help clarify whether that school offers community eligibility to provide free meals for all. All children will receive pandemic EBT benefits automatically. So all those eligible will automatically be issued benefits. There's no application process. In other states, this might not be the case, but in New York State, there is no application for P-EBT. That work was done behind the scenes with the state education department, gathering data from local districts and providing that to OTDA to make sure that all children were captured. Payments will be staggered throughout the summer. Many are curious when their benefit is coming. So it's important to let folks know that payments will be staggered throughout the summer. All P-EBT benefits are loaded on an electronic benefits transfer card. So this card is similar to a bank debit card, where you can purchase food very much like that and enter a PIN number. You can purchase food at any authorized retailer that accepts P-EBT. And it's important to note that the pinning process for each card is different. So we'll talk about who receives what type of card in this next slide. How and when families receive benefits depends on how they are certified for free school meals. Children who are in SNAP households or receiving public assistance already have a current EBT card that is active and that generally has funds loaded on that. Those families have already received, for the most part, their P-EBT benefit of $420 through this summer already. The other category is children who are Medicaid. So these children receive Medicaid and are certified for free school meals due to that receipt of Medicaid. The benefit for these families will be issued on their current Medicaid card or their CBIC card of the adult or the oldest child in that Medicaid household. That cohort will receive $420 in one lump payment. That cohort, that second group of folks, are wrapping up all their payments now. So soon all should have received that benefit who fall under Medicaid. The last cohort, and arguably the larger cohort, and making up about half of the folks who receive P-EBT benefits, are all other children who are certified for free school meals, free or reduced price school meals. Those children will receive a notice and an EBT card through the mail, and that card, once activated, will have that $420 for parents to access that benefit. Some important key messages to help families understand more about their benefits. Families who receive SNAP can check their balances. This is their way of seeing whether they've received their P-EBT benefit. There's information here of how families can go about that. Most families with Medicaid, but not SNAP, have already received a notice in the mail. So that notice included information on how to set up their PIN and how to activate their Medicaid card to use it in this way. Many of these families have never used that card to make purchases for food, so this is a new learning curve for these folks. All other families, again, will be mailed out the notice and the EBT card. So we're working really hard to help folks understand that this is coming and that this should not be mistaken for spam mail or any kind of junk mail, that this is an actual benefit. We really encourage families should read and follow the instructions, as the pinning process is different for each card, specifically between the Medicaid card and those who are getting a specific P-EBT card. Those instructions will be particularly helpful for them to be able to access those benefits. There is a P-EBT helpline to provide individualized assistance for each family. And this helpline is staffed by the Office of Temporary and Disability Assistance. We like to note here that this helpline can only help individuals who have already received notice helpline. Unfortunately, if families call before they receive any notice or any communications, it might be the fact that that helpline may not be able to help them. So some other key messages here on P-EBT. Pandemic EBT does not affect or replace other nutrition programs. So families can still, especially right now, still access summer meals if they received emergency school meals while schools were closed and picked up school meals from locations. They are still able to use pandemic EBT and entitled to a benefit. It's also important to note that you can receive these other meals from other programs like WIC, CACFP, and also SNAP. It's really important to note here that P-EBT is not SNAP. It may look and feel like SNAP in the way that EBT food benefits are loaded on EBT cards, but again, local DSS offices are not involved in P-EBT distribution or eligibility. So if a family reaches out to their local DSS or the HRA in New York City, they cannot help families with P-EBT. The helpline is really that resource. Another distinction about pandemic EBT is that it does not affect immigration status. So immigration status is not a consideration for pandemic EBT. This is super important, especially for families who may be undocumented and may only receive school meals as the only nutritional support outside of emergency meals through pantries or through soup kitchens. School meals may be the only other point of access for nutritious food. So P-EBT is available regardless of immigration status, and because that connection to school meals, it is not considered in the public charge test. This is especially important for these types of families as they receive an official notice by the state through the mail, and that automatic issuance of benefits can cause some fear, especially with this population. So we really like to make sure if you're serving immigrants that this message comes across loud and clear that P-EBT does not affect a parent or guardian or child's immigration status. All families who receive P-EBT should use it. So we all know, many of us who work with benefit programs, that there can be stigma attached to receiving benefits. So we really want to encourage families that there's no shame in using benefits, that this P-EBT food benefit is a benefit that they're entitled to, that they missed out because their children were unable to attend school. P-EBT works like SNAP benefits in a way that it can be used in your local economy, your local stores. It can be used at farmers markets that accept P-EBT. So it really helps the local economy. Benefits are also on your card for up to a year. So we want families to understand too, we are amid a pandemic and it's not over. And so more times, economic hard times could be ahead. So we really want families to know that that's there for up to a year from the issuance date, if they would like to save that for when times get hard or when heating costs go up. Families who wish to donate their food to a local food pantry, they can choose to do so. What you decide to do with the food that you buy with your food benefits is entirely up to you. We encourage individuals in the circumstance to check with their local food pantries, soup kitchens, see what they need specifically. We do want to note here, though, in terms of donation, that P-EBT cards and benefits are non-transferable. And so what that means is that you cannot give your card to another family to use at the grocery store. That would not be allowable. Hunger Solutions New York has worked to put together an outreach toolkit to make it easy to communicate these nuances to families. So we have a flyer, different sample social media posts, infographics and images to accompany those posts or to be on your website or blog posts, also a sample letter to families. We really wanted to make it easy for families to understand that this is coming and really heighten that awareness, as over half the recipients of P-EBT will soon be getting benefits. So that outreach toolkit will be linked here when you get to this slide deck. We also wanted to point out the New York State Office of Temporary Disability Assistance has a pandemic EBT website with frequently asked questions. So if you're finding a family has some nuanced questions that might be really unique to them, this is the best place to go. Also, this provides some great resources on pinning. We've mentioned this a couple of times, and there's been quite a bit of confusion with folks who are on Medicaid and pinning their cards. OTDA has put out a really great video to help walk people through that, and also instructions on that pinning process, and more in that area. We encourage you to just use whatever you can to help communicate to your families. I would be remiss not to mention the other programs, ones that you're more likely familiar with, but definitely in a different context in a year, especially a school year, upcoming school year, with so much uncertainty and operational challenges for families, for schools particularly. So we did want to talk a little bit about reopening in New York State and what that means in terms of food access. If anything, COVID really highlighted the importance of school meals. And as school meals really rose to the top as schools closed, really pointed to the importance of access to school meals and how important that is to safeguard children in our communities. So the state education department reopening guidance, the guidance is linked there at the bottom, outlines a few mandatory requirements for schools. Ensuring all students have access to school meals, regardless of how they're learning, whether that's in person or remote or virtual learning. So this will need to come with some changes to meal service to make sure that you're accommodating those different learning models. Also, a priority is obviously the safety of students and staff. So maintaining social distancing and ensuring that there is safety in that way may move meals out of the traditional cafeteria setting. All of this is going to need to come with some strong communication about all protocols to districts. So this may vary from district to district, but ensuring that families know that A, that they can provide a meal, that the schools will provide a meal, and B, how they're going to do that safely. Some also key considerations that were in that guidance is moving into this next school year, there can be confusion. Last school year, schools were able, under certain waivers with USDA, they were able to provide free meals to all students, regardless of who they are or where they came from. So this might not be the case in this coming school year, and likely will not be the case. So schools must need to communicate clearly to parents this shift in service. Many more families, the economic impact of COVID is far-reaching. Many more families may qualify for free and reduced price meals. So there's really an encouragement that schools are capturing more students in that way. Remote and hybrid learning, we want to make sure the state ed points out making sure that distribution sites are in place to ensure there are no gaps in meal access. In-person learning will look different in a way that schools might need to increase access points for providing that meal service on site. And so that model of increasing access is, luckily we have a lot to glean from Breakfast After the Bell. So Breakfast After the Bell is a program that's been used throughout New York State for quite some time to improve access to breakfast in that morning meal. And so the lessons there have can really help schools with reopening. Some of the innovative service delivery models that we've learned from breakfast has been direct delivery to the classroom, also referred to as breakfast in the classroom. This serves as an important model for serving lunch in schools, and can really help schools understand how to provide meals safely in the classroom. Grab and go is also an option that is a great way to improve access to meals. This can be done through kiosks in the hallways, gyms, pickups at entrances, and security checkpoints. Also, grab and go can be an option from the cafeteria, but given social distancing, that might be limited. Another way to ensure access in this coming school year is the community eligibility provision. So I mentioned that before when we were talking about pandemic EBT, but community eligibility is a powerful tool, and it's a federal reimbursement option under the National School Lunch Program. It allows high poverty schools to offer free breakfast and lunch at no charge to all students. This has been available since the 2012-13 school year. However, we're in extraordinary times, to say the least. We're really encouraging schools to take a fresh look at community eligibility for the 2021 school year. Many more schools may be eligible as more families are on different nutrition assistance programs. Eligibility for CEP is directly related to SNAP enrollment. So as SNAP enrollment increases, more schools may be eligible. This also means that schools who may have been eligible before, with more students participating in SNAP, can make CEP a more financially viable option than it was before the COVID crisis. How CEP, there is a ton of research about how CEP benefits students and schools. And in a time with so much uncertainty, so many operational challenges, and really a new and direct focus on social emotional learning for kids, really this program can really complement some of those competing priorities and challenges that schools are facing. CEP is shown to support student health, wellness, protecting children from food insecurity especially. Research has shown that students attending a school that is eligible for CEP but not participating, those children are at a 2 times greater risk of food insecurity. So amid rising food insecurity to alarming rates, we really want to make sure that communities are taking advantage of every opportunity possible. CEP can also simplify meal service during reopening. So specifically those models that we talked about before. It can really simplify having different access points for students to get meals and help with the accountability with the school meal programs. CEP is also a tool to promote equity. Providing free meals to all kids eliminates the stigma that is around school meals, and also with the challenge of collecting fees this coming school year. Unpaid school meal debt is an issue throughout schools pre-COVID pandemic. So now amid COVID, right, where we will see another unique set of challenges with families facing financial hardship, but also schools having difficulty with collecting fees if meals are in classrooms or in grab-and-go sites. Another piece with CEP is thinking long-term. CEP is a 4-year cycle. If schools can lock in a rate of poverty where they are now, they can, in the long term, recover deficits in school nutrition programs. Many schools across New York State, CEP schools specifically, were positioned really strategically in New York State to provide meals, emergency school meals, or those grab-and-go school meals while schools were closed. Those meals came at a higher cost for schools. And so many schools are facing a deficit this coming school year and looking for solutions. CEP can be that solution. The good news is that the deadline for community eligibility provision for schools to apply has been extended till August 31st. Typically that's shut down by June 30th. However, schools have more time to consider it this year. Eligibility is based on enrollment anytime from April 1st to June 30th, and all of the 2019-2020 direct certification data. The nuance here that I wanted to point out, if you're within a district or working closely with a district who is considering this option, we encourage you to act soon. Data is only available until August 10th for the direct certification data. After that date, the data will then switch over to the next school year to help schools transition to the 2021 school year. So while schools have till the 31st to apply, that data for the application is only available until the 10th. So that's an important nuance to point out here. So I just threw a lot at you about different ways that schools can ensure access to school meals and different mechanisms, and we can help. I really wanted to point out how Hunger Solutions New York has helped districts throughout the years and how that can translate to now amidst COVID and trying to navigate operating school meals in an accessible way in an unprecedented year. So we work one-on-one with schools to understand CEP. I do a lot of individualized technical assistance to share best practices and work through the numbers to see if it's a financially viable option for CEP. We've also worked through the years a lot on breakfast after the bell and moving breakfast into the classroom, moving breakfast into common areas like grab-and-go sites. So we offer assistance for that implementation. whether it's from equipment to staffing to cleanliness. So we have a lot of expertise in that area. And also we work a lot with national partners who have grant funding to allow those changes for innovative service models. So we really like to be sure we're connecting that to schools who need that. We can also provide resources and connect with other peers, especially whether it's a superintendent, a school nutrition director, a business official who could benefit from hearing from a peer and how they've worked through some of the challenges and of implementation of both CEP and innovative school meal models. We're happy to connect schools also with other community partners and organizations to maximize outreach for other programs like SNAP specifically to help them get more children automatically certified for free school meals. So with that, we're going to transition over back to Krista to talk a little bit about the out of school time meal programs. Krista?
Thanks, Jessica. So as you all know, it's more important than ever to make sure that we're reaching kids wherever they are. So I want to spend a few moments on the out of school time programs, starting with the Child and Adult Care Food Program, or CACFP. CACFP provides funding for healthy meals in child care settings, including child care centers, home-based daycare, and after-school programs. A provider's participation in CACFP is associated with positive health outcomes for kids, including increased consumption of fruits and vegetables and the development of healthy eating habits. But despite these benefits, CACFP is underutilized in New York, with only about half of New York's child care providers currently participating. CACFP is a fairly broad program, and it operates differently based on the type of after-school or child care program that's participating. So while we don't have time to get too into the weeds, I'll just note that there are two primary components. Traditional CACFP serves children ages 12 and under in child care centers and home-based daycare. There are a range of reimbursement rates and regulations associated with each of those settings, so I encourage you to visit childcaremealsny.org for more information about traditional CACFP. The at-risk after-school supper snack component serves children and teenagers age 18 and under in enrichment programs operating after school, on weekends, or during breaks throughout the regular school year. The at-risk program has just one set of reimbursement rates, so I was able to fit those on the slide. For the coming school year, programs can receive $3.51 per meal or 96 cents per snack served through that at-risk after-school component of CACFP. Among other requirements to qualify, programs must provide some type of enrichment activity for kids and be located within the enrollment area of a school where 50% or more of the students qualify for free or reduced price school meals. So this is another program where we expect more locations and more after-school programs to become eligible with the shifting economic circumstances in many communities of our state. So if your school or organization hasn't considered this program in the past because you knew none of the schools in your area met that 50% threshold, this fall may be a good time to revisit that eligibility criteria, and I'm more than happy to help anyone who's interested in looking at that. As we're thinking about the next school year, I want to share the latest data on access to after-school meals because there is a lot of room for growth in this component of CACFP in particular. You can see here that out of all the kids across the state who eat free or reduced price lunch during the school day, only about 1 in 5 receive any type of after-school nutrition, whether that's a meal or a snack. And if we break that down even further, we can see that fewer than 7 in 100 low-income kids have access to a complete after-school meal. In years past, many schools and after-school programs have opted to serve snacks after school rather than a complete meal. But as we look for ways to better support children and families amid rising food insecurity, switching from snacks to meals or starting to serve after-school nutrition for the very first time is a great opportunity to make sure that kids are receiving 3 healthy meals a day. Some of you may be wondering if or how CACFP can work within social distancing and in the event a childcare or after-school program is unable to provide in-person meal service. So I wanted to quickly note that the same waivers that are in place for school meals for the coming school year are in place for CACFP, and those allow for non-congregate meal service, meaning that kids don't need to stay and sit and eat together at a program. The waivers also allow a parent or guardian to pick up meals and bring them home to the child, and they allow for some flexibility in some of the usual regulations for meal times and meal pattern requirements in the event of a food shortage. We're advocating for some additional waivers, including a waiver for the after-school enrichment activity requirement, but these are the nationwide waivers currently available for next school year. And if anybody wants to learn more about this particular topic, please feel free to reach out and connect with me. We're covering a lot in a little time today, so I would encourage you to visit afterschoolmealsny.org or childcaremealsny.org for much more information about CACFP. And if you have opportunities to promote CACFP to childcare providers, schools, or after-school programs in your community, we have outreach resources on those web pages that you can use to help spread the word. Of course, we can't talk about out-of-school time programs without talking about summer meals, which are in full swing in many communities across the state. Most summer meal sites are what are called open sites, meaning any child or teenager can drop by for a meal without being enrolled in a program. There's no application, there's no identification needed. These sites are truly open to all kids and teens age 18 and under. And while normally kids would sit and eat right at the summer meal site, this year, given the need for social distancing, many sites are offering grab-and-go meals or home delivery. In 2019, 380 sponsors served summer meals at nearly 3,000 sites across the state, which is an incredible effort. Still, as with CACFP, there is significant room for growth in summer meals in New York. When you compare the number of kids who eat free or reduced price lunch during the school year to those who eat summer meals, we're reaching only 1 in 4 low-income kids over the summer. Outside of New York City, that number drops even further to fewer than 1 in 6. We see especially pronounced gaps in access to summer breakfast compared to summer lunch, and to summer meals in August compared to July. So how do we increase access to summer meals? For the many summer meal programs that are already underway this year, we can all help with outreach to make sure that families know where and how they can get summer meals. We have a range of outreach resources available on summermealsny.org, including flyers, graphics, and social media posts. All of those resources direct to mapping tools and hotlines where families can find sites near them. I will note that the mapping tools are being continually updated, but there may be additional sites operating in your area that aren't showing up on the map yet. So I would encourage you to touch base with your local school districts and summer meals sponsors for a complete list of sites. And we have a directory of sponsors you can use on summermealsny.org. We encourage everyone in the community to get involved with Summer Meals Outreach. Please consider engaging your local schools, libraries, WIC clinics, healthcare providers, youth programs, faith-based communities, and others to make sure that families are hearing about summer meals from a range of trusted messengers. And even though we're still in August 2020, it's never too early to think about next year, especially given the increased need for meal programs and for summer learning opportunities as we work to build back from disruptions in our school schedules and in this year's summer programs. If you might be interested in serving as a summer meal site or helping to recruit new sites in underserved areas, there are helpful resources available on summermealsny.org. First, the USDA's Capacity Builder map provides a wealth of information, including help determining whether an area is eligible to offer summer meals in an open site. This is another program where sites must be located in areas where 50% or more of the kids qualify for free or reduced price school meals, though some locations were able to get that requirement waived for this summer in particular. But again, we expect more areas to become eligible next summer, so check back over the fall and winter for updated data on the USDA Capacity Builder map. In addition to determining area eligibility, you can use the capacity builder to see where sites operated last year and this year to identify some gaps in access. You can also overlay locations of schools, libraries, YMCAs, and other types of potential sites, so you can see where a site might work well if there is an underserved area. Summer meal sites operate under sponsoring organizations that manage the program at the local level. To make it easy for new sites to get started, we publish a sponsor directory, as I mentioned earlier. If you're interested in becoming a site or helping to recruit sites, please feel free to use that directory to connect with sponsors near you. So in these last few minutes, I want to touch on SNAP and WIC, two programs that are available to families and that many of you already work with or have opportunities to promote. As I'm sure many of you know, SNAP, or the Supplemental Nutrition Assistance Program, provides monthly food benefits to eligible households. And when a household participates in SNAP, the children in that family are automatically eligible for free school meals as well. So as Jessica mentioned earlier, there's a direct connection between SNAP participation and schools' opportunities to tap into community eligibility and other nutrition programs where eligibility is based on the number of children who qualify for free or reduced price school meals. We've developed an outreach toolkit to help schools and community partners spread the word about SNAP, while also encouraging families who may be just over the income guidelines for SNAP or otherwise unable or unwilling to participate to still consider applying for free or reduced price school meals. Again, we have a flyer, social media posts, and graphics, all of which can be easily lifted and used throughout all of your communication channels. In light of the recent storms that have left hundreds of thousands of New Yorkers still without power, we want to be sure that everyone knows about replacement SNAP benefits. If a household lost food purchased with SNAP benefits due to the power outages, they may be eligible for replacement SNAP benefits. Households have 10 days to report that loss to the local DSS or HRA office, so this is a really time-sensitive outreach effort. If you have opportunities to help spread the word, please access the toolkit that I've linked here, which includes an outreach flyer you can use, the form to request benefits, and some additional information about the criteria and requirements for replacement SNAP benefits. And the last program we want to talk about today is WIC. Some of you may be familiar, but just as a really quick review, this program provides many benefits to pregnant women, new and breastfeeding moms, and children under the age of 5. These benefits include healthy food, breastfeeding support, nutrition advice, and referrals to other services. Someone may be eligible for WIC if they are pregnant, a mom of a baby that's up to 6 months old, a mom of a breastfeeding baby up to 12 months old, or a child under the age of 5. Something that might not be quite as well known is that dads, grandparents, foster parents, and other non-maternal caregivers can apply for WIC on behalf of children in their care. Many families are eligible for WIC but not participating. And I want to take a moment to show you the coverage rate for WIC in our state and how it's changed over the past several years. This is the map for 2014. In counties that are shaded green, more than 50% of eligible households were participating in WIC. Yellow shows a participation rate of 41 to 50%, orange is 31 to 40, and red is the worst at less than 30% of eligible households participating. I'm going to flip through maps for the next few years so you can get a sense of how participation has changed over time. So again, this is 2014, 2015, 2016, 2017, 2018, and 2019. So you can see that over time, participation has decreased, and that based on the most recent data, which is from April 2019, the vast majority of counties had less than 40% participation among eligible families. And we know that the need has only risen since April 2019. The good thing is that there is good news to share about WIC that may encourage more families to participate, and that is that e-WIC is here and paper checks are a thing of the past. You may have heard that in the past, WIC food benefits were received on a check and a family had to buy everything on their food list at once. That's not the case anymore. The EWIC card acts just like a debit card that is swiped at the register. Families can shop when it works best for them, either all at once, or they can go back to the store as many times as they need to use their benefits by the end of their 30-day WIC cycle. Similar to our other program resources, we have a variety of outreach materials you can use to help spread the word about WIC, including some of those lesser known aspects of the program, like that caregivers can apply for children under the age of 5 in their care, and that eWIC is here. You can access these resources on wichelpny.org. We have a whole resource center with a range of flyers and graphics you can download. We're working on some Spanish translations that will be coming soon. We're also working on some new resources focused on 3- and 4-year-olds who are the least served group for WIC. We also expect to do a round of free bulk ordering later this summer, so you're welcome to connect with us or use the bulk order form that's linked here if you're able to distribute print flyers. While I could say a lot more about all of these programs, I'll leave it there and encourage you to please visit our program websites to learn more. We have each of them linked here, and again, you'll be getting this slide deck so you can easily visit the links. And of course, you can always connect with us directly. We've included our email addresses on this slide, along with the link to sign up for our email alerts, which we send when there are program or policy updates, grant opportunities, and other newsworthy items related to the federal nutrition programs. So it looks like we've got plenty of time for questions. We'll go ahead and take a look at what's come in through the chat box and the question box.
So Krista, I'm not seeing anything in the chat box, but feel free to enter questions as you have them, either in the Q&A box or the chat box.
Okay, we definitely have some questions in the question box. I'm just combing through them right now. Okay, there was a question about whether there have been any waivers for delivering meals to families who have elected to learn remotely. Jessica, I think this might be a question I'll give to you.
Sounds great. So there are waivers in place for parent pickup, which also, and you can correct me, Krista, this also allowed schools to do home delivery for meals. And so from my perspective, yes, that's in place. Schools need to apply for each waiver that they are planning to use with the Department of Education. Is that your understanding too, Krista?
Yes, I think you summed it up. All right, and then we've got a question here. Some of my clients who do not receive SNAP state that they have not received their temporary cards to access P-EBT funds. So you may have put this in before we covered this, but just in case, the final cohort of P-EBT distribution is just getting underway in August. So tell those families to please keep an eye out on their mail. They'll be receiving both a notice from the New York State OTDA and separately a P-EBT card. We want to make sure that they don't accidentally throw away either of those things and that they get those cards. So please ask them to keep an eye on their mail throughout the month of August, possibly into early September. Somebody asked, why didn't children attending early Head Start and Head Start programs receive eligibility for the P-EBT? I think that's a great question. I'll clarify that, again, the eligibility is based on National School Lunch Program, as P-EBT is currently written in federal legislation. So there are some UPK kids who do receive meals through the National School Lunch Program. Others, like a lot of Head Start programs, receive meals through the Child and Adult Care Food Program, and so those children unfortunately do not qualify for P-EBT at this time. That is something that we are doing some advocacy around. We're urging Congress to expand and extend pandemic EBT, but for now it is connected to National School Lunch Program. Okay, we've got a question, how long are these benefits going to be for? Jessica, I don't know if you want to take that one on.
Sure. So These benefits is a one-time benefit, the way that the current law was written for P-EBT. So currently, it only provides that one-time benefit of $420, which is on the card for 365 days from the date of issuance, so 1 year. So that is available that way. Again, going back to what Krista had mentioned, to expand and extend P-EBT is an advocacy point that we are working on.
Okay, we've got, are the benefits issued on the child's card or the parent's card? I would say it depends, and that it's either going to be the parent's card or the oldest child in the household. I believe that the notice will be sent to the member of the household whose card the benefit will be on. So people should carefully read their notices. If they have questions after they receive that notice, please direct them to the P-EBT hotline. We've got a question about homeschooled children, and then we have a couple other questions about different childcare settings. So I would just reiterate that the lever right now for being eligible for P-EBT is the National School Lunch Program. So most homeschooled students wouldn't participate in the National School Lunch Program, and same thing for childcare, unless it's a UPK program where the kids receive meals through the National School Lunch Program. Unfortunately, they're not eligible for P-EBT at this time. Okay, if a family has an eligible child in school that also has a sibling that is pre-K age, but there's no pre-K program in that school district, does the pre-K child also get benefits even though they were not in school? So the answer here would be no, because that pre-K child didn't receive meals through the National School Lunch Program. If they did, then they would qualify for a benefit as well. Jessica, I'm going to give you one if you don't mind. Are there restrictions on the types of food that parents can buy using P-EBT?
So yes, these fall under the same rules as SNAP benefits on EBT cards. There is a resource of authorized retailers and types of food as well that we can put in the chat box here.
Great, and I've got somebody asking, after we post the webinar, will we be able to share this with community partners, including school districts? Yes, please and thank you. We would love for you to share this with other people. We're really trying to get the word out about all of these programs, so please do feel free to share these resources and to share our contact information as well. How can a public library help? We're currently a summer lunch site. Thank you for this question. Libraries have been instrumental in outreach for all of the federal nutrition assistance programs. So I would encourage you to think about any opportunities that you have to communicate with families about P-EBT, to help them understand that this is coming, that they should watch their mail, how they can use those benefits. It's great that you're a summer lunch site. If there's any libraries online who are not already serving summer lunches, you can still help with outreach to other sites. Think about if you have opportunities to distribute maybe flyers for SNAP and WIC if you're doing curbside pickup for books or meals. I think there's a lot of great opportunities for outreach, especially for this libraries to get involved. Okay, we've got somebody saying that their clients are having a hard time setting up a PIN number. I would definitely encourage you to take a look at the video that OTDA posted, along with their FAQ. Their resources have been so valuable in helping people get through that pinning process, and the video especially, I think, helps sort of walk through which numbers to put in when, in a way that can be really useful. So that is linked in the slides as well. When will P-EBT arrive for parents not on SNAP or Medicaid? No one we know has received the benefits in the mail. So again, households that are eligible for free or reduced price school meals but are not participating in SNAP and Medicaid will receive their benefits in the third cohort, which will be happening throughout the month of August and possibly into early September. So clients can receive both SNAP benefits and P-EBT benefits at the same time. Yes, absolutely they can. So P-EBT is not SNAP, and so we would encourage that families make full use of both programs. Okay, we've got a question. Families with free lunch but no food stamp cards, do they have to do anything to apply? No, no one has to do anything to apply for this program. We're really grateful that it was set up that way. Benefits will be issued automatically. Okay, this is an interesting question. Do we have any information about why some kids get P-EBT and others have not gotten their benefits in the same household? Jessica, I don't know if you feel comfortable taking that one.
Yeah, so I think there could be a ton of nuance happening in that specific circumstance, but I can take one example of an individual that I helped on Medicaid. So in that household, once talking through her house, her and her one son were on a separate case, had their own case for Medicaid, and then the other son was in a case by themselves because that child had disabilities. So that nuance there showed that they were in different households, so that that issuance was different. And also, you know, the way that households under Medicaid versus households either under SNAP or Medicaid, how they form their households may be different than the actual number of people living in their household, if that makes sense. So it may be that certain children are not included on their SNAP case and who live in their house. So again, it goes back to how each child is certified for free school meals, and it could be that even from sibling to sibling, they might have a different status that certifies them differently for school meals. So that was a little bit of a complicated answer, but those situations typically have some nuance and complication. So we've run into this a few times and encourage families to be patient, which I know is difficult in this difficult financial time, but to be patient, and that benefits are coming soon for the rest of their children.
All right, and we have somebody asking if you'll receive a copy of the PowerPoint. Indeed, you will, and you'll get all the slides with all the hyperlinks, phone numbers, email addresses, all that good stuff. We'll send that along as soon as possible after the webinar. Somebody asked, is there a call center specifically set to answer questions about replacing Medicaid cards or P-EBT cards? Right now, the best place to direct folks who have received a notice and need to ask it for a replacement card would be the P-EBT helpline. And again, that number is going to be available in the slides that you receive. It's also available on our P-EBT webpage. And just a reminder that that helpline is primarily able to help people after they receive a notice. If they haven't received a notice yet, there's a good chance that that household's information isn't in sort of the P-EBT helpline system quite yet, so the operators might not have the information that they need to help them. Okay. I have a client that's been receiving SNAP but didn't receive the P-EBT benefits yet. What we've been encouraging people to do is to check their SNAP balance and really like double check it, because that P-EBT benefit might look like two separate payments on the EBT account. So it might look like one payment of $193 and then a second payment of $227. And so that might be confusing to people if they're expecting to see $420 and they don't see a deposit that looks like that. So we'd encourage them to first double check their EBT balance. All right, and it looks like we're right at 3 o'clock, so we're going to wrap up. We do have some questions that we didn't get to, so we'll try to follow up with folks about those. You can also please feel free to reach out to us with anything. Thank you again for taking the time to join us today and for all the work that you're doing to expand food access. We'll follow up with the recording and slide deck so you'll have access to all of this information, and we look forward to working with you all. Again, thank you. Have a good afternoon.